We started Hospital Rooms after a really good friend of Niamh and mine was sectioned after a suicide attempt. We were really surprised by what a mental health unit looked like. To be honest, I'd never been in an inpatient mental health unit, and I was quite shocked by how clinical it was, how uncreative it looked, and when someone you know is really unwell, you want them to be in a place that makes them feel like they're comfortable, or makes them feel like someone's thought about that space they're in.
Hospital Rooms is an arts and mental health charity that radically transforms mental health hospitals in the UK.
Over the past 5 years, we've worked with artists and mental health patients and staff to commission more than 120 ambitious, co-produced artworks for more than 20 of the most challenging mental health units.
We commission professional artists to lead highly imaginative and adventurous workshops, from owl life drawing to creating film animations using 3D scanning. These workshops result in the creation of major installation-based artworks that transform mental health ward environments. We offer patients and staff creative opportunities on their own terms.
I think the work of Hospital Rooms is really important because what it really is saying is that there should be no barriers to culture, and there should be no barriers to people experiencing and living with art.
The health regulator in the UK and the NHS 5-year forward view cite mental health units as being inadequate and not conducive to recovery. We know that bringing art into these spaces can have tangible health benefits. Despite evidence to show that arts can help patients to maintain a sense of personal dignity and control in what are often distressing circumstances, access to art or creativity is extremely limited in mental health hospitals.
We see firsthand the impact that art and the access to creative activities has on people in mental health hospitals. We take a rigorous approach to evidencing our impact and have formulated an evaluation methodology in collaboration with clinical teams in the NHS and researchers at Norwich University of the Arts to better understand and to improve our work.
We have adapted the Arts Observation Scale in a form that employs the use of emojis. The tool has proved sensitive to self-reported participatory arts-induced mood changes, even for very unwell patients in secure services. It has demonstrated mood uplift in all of our participants as a result of taking part in our workshops. By analysing patient experience data, such as PEDICs and PREOMs, we have seen increased patient engagement with the environment, staff, and community on wards. We have used the visual matrix methodology and semi-structured interviews to gather rich qualitative data about our work. These demonstrate positive culture change. Ward environments are perceived as less clinical and more personal. Staff well-being has been enhanced, and the quality of patient and staff interactions improved. In a project that is due to be completed this year, we have observed that the improved interactions between patients and staff has led to fewer incidents on the ward and less use of restraint, and subsequently increased instances of innovation in the service. In 2022, we will launch our most ambitious project to date in collaboration with Healing Arts. We'll commission 20 major artworks for a new mental health hospital being built in London that will radically transform how mental health hospitals look and feel.
We've enlisted an internationally acclaimed and diverse roster of artists who put vulnerable people at the centre of their work and specialise in participatory practice. The project will forge a new path for mental health services and making access to creative participation central to the culture of the hospital. Through this project, we aspire to raise awareness about the role of arts intervention projects in mental health hospitals through evidence-based research and influence strategic change at an international level. The findings from this project will feed back into the work that we do and demonstrate unequivocally that the arts can heal.
Okay, hi, I'm James. I'm from Phoenix Ward. I have a diagnosis of schizoaffective disorder. I've been in hospital now for about 2 years, mainly in Phoenix Ward, and I've been astonished by how good the rehabilitation has been on Phoenix for me, and a lot of that is down to the artwork which is actually on the wards. We have special pictures in the table tennis room where I play every day, which have been set up by this association, this arts association, and it's really uplifting, actually thinking in new ways through the arts, and it kind of dispels sort of the stagnant nature of ill health sometimes, to see pictures that are mind-blowingly interesting. And I've been to some of these art workshops myself as well, outside of the wards, and they've always been fascinating. They're opening up things in my mind that I didn't realise existed, and as a result I feel I can relax and actually integrate with people properly and get rid of my anxiety. So as you can probably tell now, I'm speaking a lot better because I've been on this workshop to do with charcoal, basically. So I've had a great time, and I'd like to say thank you very much to all of you for your help.
Thank you so much, Tim and Niamh. Hospital rooms.